We've got 1 minute, less than a minute. To give you the very latest information on what's happening in Orange County with this coronavirus pandemic. Speaking today will be Orange County Mayor Demings, Mayor Buddy Dyer. Then Mayor Demings will get up and speak again. Following Mayor Demings will be Dr. Christian Zuber, the Medical Director for Orange County Health Services, Dr. Robert Pino, for the Department of Health Officer, Sheriff John Mina, and Scott Howard, Communications Director for Orange County Public Schools. After the speakers are done, we'll open it up for questions, and we invite our Hispanic media members to ask questions of Dr. Pino at that time. And now I'd like to introduce Mayor Demings.
Okay, thank you, Jane, and thank you to Mayor Dyer and to Sheriff Mina and all of our program participants for being here this afternoon. I would like to reiterate that should any of you, the Spanish-speaking media, have questions when we get into the question portion of this update, feel free to jump in. You know, we know that Dr. Pino is bilingual, and he'll be able to respond in Spanish to you real time. As we move forward today, we see the numbers in Orange County have climbed significantly from the last time that we came before you. We're now at 293 cases according to the Florida Department of Health website, 293 cases, so nearly 300, and that was as of just a few hours ago. So more than likely at this point we have surpassed that 300 number, and that is significant. It's concerning to us as these numbers are going up. The youngest patient, if you will, here in Orange County is an infant up to a 90-year-old, and so that means that it runs the gamut. What we're saying to our community is that even though we're the 5th most populated county now in the state of Florida, that puts us at 293, just behind Miami, Broward, and Palm Beach counties. So we're in the number 4 spot when we're the 5th largest county. It's not a place that we really want to be, but my observation is that most of the people in this county are now complying with the stay-at-home order, but we are not yet where we need to be in flattening the curve. We have not peaked, and I do not really want to be in a position as a county where we overwhelm our healthcare system here within the county itself. And so it remains very, very important to all of us that we continue to practice social distancing and that we heed the warning of the stay-at-home order. As Dr. Raul Pino has stressed many times, you must act like everyone has the virus in order to protect yourself. You must act like everyone has the virus in order to protect yourself. And so as we move forward in the coming days, we want to remind our public that your health and the health of your loved ones are our primary concern. When we talk about how this has not only impacted individuals but impacted businesses here in the area, it has been significant. I had the privilege just a few minutes ago to have a call with Congressman Darren Soto, and he reiterated that in terms of the financial assistance, it's on the way. As you know, the federal government recently approved the CARES Act. The CARES Act will provide a number of resources for our local businesses, including the Paycheck Protection Program that allows small businesses to receive forgivable loans to help retain employees and avoid layoffs. We are continuing to gather information on that program and would gladly put it up on our website here within Orange County. The Paycheck Protection Program and other approved programs we know will work to help our local businesses. Information is on our website and will be updated as we get information under our business resources at www.ocfl.net/coronavirus. And let me talk a little bit about our Meals on Wheels program. They need more volunteers in our community. I'm fortunate I have a 97-year-old father, and he is a benefactor of the Meals on Wheels here in our community. Our community continues to rally together and are helping each other by staying apart, but coming together when we need to. When we talk about the Meals on Wheels program, the Seniors First program really administers the Meals on Wheels program and delivers nutritious meals to homebound seniors. Unfortunately, many of the volunteers at Meals on Wheels are unable to deliver meals, as many of the volunteers are seniors themselves. More than 200 volunteers deliver nearly 4,200 meals to nearly 500 different recipients in the greater Orlando area. That's 800 to 1,000 meals delivered Monday through Friday here within our community. If you can volunteer or know someone who can, we ask that you visit the seniorsfirst.org webpage and receive information there. And Mayor Dyer, I am told that the Orlando Police Department has stepped up to the plate and has themselves been participating in delivering some Meals on Wheels within our community. So it is truly gratifying to see a community come together to protect each other in this manner. In terms of social media, I want to thank the public for following us at the various social media areas and channels as we have moved forward with this pandemic. Everything we discuss in these news conferences are recapped on our social channels, and it includes links so you can listen and share your thoughts with us. Our news conferences are viewed more than 50,000 times, and many residents have contacted us on social media and have been engaged and informed. I encourage our residents to also reach out to us through 311. If you live within Orange County, you can just dial 311 for normal access to normal county services, as well as get information regarding the pandemic itself. At this time, I'm going to ask Mayor Dyer to come forward and share some thoughts with you as well. Mayor Buddy Dyer.
Thank you, Mayor Demings. You know, I want to begin by thanking all of our residents, our businesses, our not-for-profit community. Thank you to all of you. We've had to make some really hard adjustments in our lifestyles these past few days and weeks, our daily lives, our working schedules, even the way that our children are learning. And they're not easy. It's not comfortable, but these are short-term changes that'll make all the difference in the long term of our community. Today is Doctor's Day, and I know Mayor Demings can talk a little bit more about that, but it's a timely reminder that they work for us, so we should stay home for them. Every day I continue to be inspired by our community as we take on the shared responsibility for helping our family, helping our friends, helping our neighbors, our healthcare workers, and our first responders through social distancing. I'm inspired by how we're making working from home work. For almost 2 weeks now, our city government has continued to provide our essential municipal services, more than 290 online services, including we had our first virtual city council meeting that we just finished up with, and it worked. Businesses across our community have been telecommunicating, and today nearly 200,000 students in Orange County began learning at home. So I salute the teachers and the administrators and the parents who have been so quick to adapt and find new ways to ensure that Orlando's youth continue to stay engaged and have a quality education. And these efforts, I can tell you, they're making a difference and will continue to make a difference in our community. But we can do more, and we must do more. I want to encourage the businesses that were considered essential, that are open to take steps to allow their employees to work from home if at all possible. As a city, even our employees in the Permitting Services Division are working remotely. We've moved from full-time and part-time to alternating schedules, smaller staffs to promote the physical distancing. And we have also announced that we are extending the expiration dates on all of our open building and trades permits by 6 months. So that means you won't have to go in person or online to try to extend those permits. So again, I know this is a difficult time for our businesses. I want to commend and recognize the Orlando Economic Partnership and all of our economic development organizations and chambers for the support that they're giving to businesses during this challenging time. The sooner we can stop the spread, the more we can flatten the curve, the sooner we'll be back on the path of recovery. Also want to remind residents who are in need or either financially or emotionally, physically, there are resources available. Mayor Demings mentioned most of them, the Orange County Crisis Assistance Program, Heart of Florida United Way 211, Aspire Health's dedicated mental health assistance hotline, and Second Harvest Food Bank. And all of those are listed on orlando.gov. I want to mention that both Lynx and Sunrail have reduced their schedules. You should go online at one or both of their websites if you're still taking public transportation to see what those schedules are, and also Lynx has suspended fares. These are difficult times that we're going through, but we must continue to help each other and continue to find some joy and to uplift each other as we socially distance ourselves. We need to make sure that we maintain our social relationships with our families and our friends. I even had my first virtual happy hour last week, and it worked out pretty well. So I would encourage you to follow suit on that one if you're so inclined. But we need to stay mentally healthy during these challenging times. This is not going to be over in days or weeks, so we need to make sure that our community's strength of kindness and compassion is what we all think about. Thank you. Mayor Demings.
Thank you, Mayor Dyer. And as you mentioned, today is National Doctors Day, and we are thankful for all of our physicians in this community, as well as the support staff that they have with nurses, healthcare workers, and EMS staff who are on the front lines. I'm joined today by Orange County Commissioner Myra Uribe, because here within our Orange County family, we have several physicians who we want to recognize today as well. We have our EMS Medical Director, Dr. Christian Zuver, who is here, who you'll hear from momentarily. And of course, thank you goes to Dr. Raul Pino of the Florida Department of Health here at Orange County. He has been with us for most of these press events as well. And I'd also like to recognize several other Orange County physicians. Our Chief Medical Examiner, Dr. Joshua Stephanie, and one of my own neighbors works for us here, Dr. Maurice Mascal, the Medical Director at the Corrections Department or the jail. And we also have Dr. Alexa Rodriguez, the Deputy EMS Director. So kudos to all of our physicians who are here in our community, as well as those who work for Orange County. At this time, I'm going to ask Dr. Zuver to come forward and speak about the heroic efforts that doctors, nurses, and healthcare staff workers have been doing in this community, especially in this world health crisis, this pandemic, COVID-19. Dr. Zuver.
Thank you, Mayor Demings. On behalf of all of the men and women, not just doctors, but doctors, nurses, our first responders, and all healthcare workers on the front lines of this pandemic, keeping our citizens safe in Orange County, we appreciate everyone's thoughts. And we also appreciate the efforts being taken to keep us safe. In addition to my role as EMS Medical Director for the Orange County EMS system, I'm also an emergency physician. In the field with first responders, I supervise and oversee about 2,000 responders who are every day out there taking care of our citizens. And all of the healthcare workers, they do so knowing the risk associated with exposure to this and other illnesses as well. I think that one thing I can't emphasize enough is that protecting these first-line workers, the doctors, the nurses, the first responders, the other healthcare workers, it's never been more important. We serve and we function and we're very vulnerable right now in this point in society and time right now. And you'll hear this, and you've heard this before, and Mayor Dyer mentioned it, but we'll do our part. So we will go to work every day on the front line for you, but we just ask that you stay home for us. We have families. We care about them as much as you care about your families. And we want to protect them as well. And so anything we can do to decrease transmission is essential. And that means staying at home, and staying at home unless it is absolutely necessary. Our enemy right now in this battle is invisible. We can't see the virus, but it's out there. But there's things that we can do that can show that we care about one another and we care about our medical community. I think it's important that we continue to follow CDC guidelines, social distancing, personal hygiene, hand sanitation. Follow the executive orders, and none is more important than our stay-at-home order right now. We need the community to continue to stay at home to keep us all safe, not just the medical workers. Because we have to remember that patients who are suffering from COVID-19, they can be asymptomatic as well. They may not know they have it, and that can still be transmitted and not show any signs. So someone could carry it and transmit it. And that's why it's important for everyone to stay home. You don't know who you are if you have it or don't at this point in time. And so you stay home, it keeps you safe, it keeps your family safe, it keeps my family safe. And this is about our community. It's about everyone, protecting everyone. I just want to say thank you to Mayor Demings and county staff for their continued support, and the community for their continued support. We're incredibly lucky to live in the community we live in. And thank you. And now I'd like to turn it over to Dr. Raul Pino, who is the health officer for the Florida Department of Health in Orange County.
Thank you, Dr. Zuber. I would be neglecting not to wish every single doctor happy Doctor's Day, and a very fitting moment to thank not just the doctors, but also the staff that support their work. And in this time of tribulations that we are facing, their help is needed more than ever to keep our community safe. On a personal note, if you allow me, I would like also to thank my son and my daughter-in-law who are in New York working in one of the hospitals facing this pandemic, and she was diagnosed today with COVID-19, but I'm pretty sure, Chloe, everything will be fine. With that, we continue to do our testing. As you heard the mayor mention, we have 293 cases officially, but I'm pretty sure we already surpassed 300. We are the fourth county, as was mentioned by the mayor. 272 of the people diagnosed are residents of our county, and the median age, the average age has decreased from 47 to 45, which indicates that younger people are getting affected by the disease in our county. We also have only, and I say only because it's a significant low number for the numbers that we have seen, 51 hospitalizations that we are aware due to the virus. And during the weekend, there were 4 deaths in our hospitals, but none of them county residents. So it will not count in our death count in Orange County. I also want to inform the public that our vital statistics office will be closed. The lobby to the public, that's the place where you get your birth certificate and the certificate, and everything will go online. with vital check system, which we have in place, and funeral homes, as they process sometimes large amount of data, will be allowed to come by appointment. Also, I want to inform the public that the CDC has developed an app with Apple, and it's available in the Apple Store. It's quite interesting. I have used it. I have it in my phone, and it allows you to screen yourself, to have some critical questions, and also what the criteria for testing is. So check it out. It's quite interesting. With the WIC offices, as we start today from 8 to 5 weeks offices around the county, we would like to encourage people to call us and to call WIC before you come if you are not sure that your office is open. We don't want you to travel to our office and go through the hassle of getting there and finding that the place is closed. We have extended all WIC certification for another month so that we reduce the need of people coming to us. And also, I want to reiterate to you, we have services for you. We have WIC for pregnant women, women that just had babies, and for babies younger than 5 years old. And we have plenty of room for you and for the services that you need. The number to call for WIC is 407-858-1494. Thank you.
Thank you, Dr. Pino. So we've now been through our first weekend of the stay-at-home order, and I'm pleased to say that the Orange County Sheriff's Office has had very few issues with businesses and residents in our community, but there still are some businesses who are remaining open in violation of the order, and we are still continuing to respond to, like I said, very few of those to make sure that they are in compliance. We've also responded to several large gatherings or groups, mostly younger adults, so we're asking them, again, to please adhere to the order. And remember, every time a law enforcement officer has to go and contact those folks at those large gatherings and remind them to practice social distancing from our community, that's just another chance where the virus can spread. So since Friday, we've also received a number of calls from people who have either had questions about the stay-home order or actually calling to report businesses who they think are non-essential. So we encourage that. If you have questions, to call us. If you want to report a business who you think is non-essential and they are remaining open, we want to know about that because we want to enforce the order and make sure that they stay closed. But we would ask that you please call our non-emergency number to do that. It's 407-836-4357. Again, that's our non-emergency number we want you to call in order to keep our emergency 911 lines clear. It's so important for people to stay home. Staying home is going to save lives by reducing the number of people who can be exposed to the virus and the number of people who can get critically ill because of it. And believe me, we all know how inconvenient it is. We all know how uncomfortable it is, but we all have to do our part. And the doctors, the healthcare providers, our law enforcement officers, all those paramedics and EMS personnel, they are on the front lines and they can't stay home. And we have to help them. We have to help them because we can't stay home. We can't say we're not going to go to that call. We're still out there. Unfortunately, there are criminals out there who take advantage of these times. We're still arresting criminals. So it's important that people who don't need to be out and about stay home and adhere to the order. And so we know these are very confusing times. Unlike a hurricane or other emergency, this is a prolonged effort to keep our community safe. And we're not exactly sure how long that will last. But again, we're asking you to stay safe, stay home, help us, help you, and adhere to the executive order. Because again, we will enforce the order if need be when people are violating that. But I do want to reiterate that the men and women of the Orange County Sheriff's Office, the men and women who are protecting your streets from all the municipalities in Orange County will risk their lives for all of you, and they risk their lives every single day just by being out there and being exposed to the virus because they're unable to stay and work at home. So thank you. This time I'll introduce Scott Howitt from Orange County Public Schools.
Thank you, Sheriff. Good afternoon. On behalf of Dr. Barbara Jenkins and the school board, I'm here to give a brief update on today's first day of distance learning. Orange County Schools began distance learning today for all 212,000 students, as Mayor Dyer mentioned earlier. Our secondary students all have computers. They're one-to-one and are very familiar with our digital learning platform. And we've continued to provide hotspots for those individuals who need them at the secondary level. We know that our elementary students have a kind of a dual approach where some are learning digitally and online and some will be learning through student learning packets. We do know today we did have a number of issues, connectivity issues. We had high volume login. Just to give you an idea, this morning between 9 and 10 we had 80,000 logins to our system during that time. Of course, it slowed down to a crawl and in some cases to nothing. We quickly got together with our vendors and worked to resolve the issue and stabilized it by midday. Today we had about 129,000 logins, 118,000 students logged in, 11,000 staff members. So we're well underway, distance learning, learning virtual in Orange County Public Schools. Just to give you an idea, and we know that this is new territory for us. It's a road we're traveling where there really is no map. We do know that we have the tools in place because of the citizens of Orange County and the half-penny sales tax, and our secondary students are very familiar with that. This is very similar to the first day of school. We know there'll be bumps in the road, and we just need to deal with those as we go, and our staff is working very, very hard to make it happen. We appreciate the parents for their patience, for our teachers, for their incredible work that they've done in preparing and what they're doing to work through these issues. Just wanted to bring you up to speed on our Grab and Go meal program. The Grab and Go meal program is continuing at 50 sites this week. We will have changes to the program that'll be effective Wednesday. We're going to consolidate some sites and we're going to add some additional sites to that program. The Grab and Go program, meal program, will be for any child 18 and under to pick up food at any one of the 50 sites that are available between 10 and 1. And any changes will take place on April 1, and you can visit ocps.net for locations or any changes in locations. Just to wrap up, any of the updates and any of the things that are going on in Orange County Public Schools can be viewed on ocps.net. You can follow us on Facebook or Twitter. We're putting out information there. We'll make sure we are updating our Grab and Go meal sites. Also, any information related to distance learning will be out there. They can visit our website. We're putting together, we have information organized there. We're putting together additional FAQs when it comes to distance learning. And we want to remind parents, if you haven't heard from your teacher or you haven't been in contact, reach out to the school. There's a general email address number at the bottom of the web page of every school's website that will go directly to the principal. You can also reach out directly to your teacher. We want to make sure that every student connects with all their teachers this week, and we get started with distance learning this week and as long as we have to continue to deliver a high-quality education to the students of Orange County. Thank you, and thank you, Mayor.
Scott, are we the 9th largest school district?
8th in the country.
Okay. Wow. A lot has changed in just a short period of time. Who would have thought maybe a month ago that the 8th largest school district in America will be doing 100% of its teaching through distance learning? That is just nothing short of phenomenal. It tells you really the impact and the breadth of the impact that this pandemic is having on our community. There were some things that Dr. Pino said that I hope wasn't lost upon anybody listening or viewing today. He said that there were additional people who died in this county of the COVID-19 virus. However, they were not residents of the county. But it says and suggests to us that this is really important to our entire community, why we are taking these extraordinary measures within this community. He even mentioned, Dr. Pino mentioned that a daughter-in-law of his in New York, who was a healthcare worker, tested positive. So it does touch families, it touches individuals, which makes this something real that we are dealing with as a community. And so that's why you heard a consistent drumbeat from the various speakers today who said to you they implored residents of our county to really adhere to the warnings and to stay apart. We don't want anyone to die from this virus. We don't want anyone to catch this virus. So with that, I'm going to open it up for questions at this time. I would remind you that if you're Spanish-speaking media, if you have questions in Spanish, Dr. Pino is fluent. So are there questions at this time? Okay.
How does it work? Okay, thank you. Sheriff John Mina, please, if you don't mind.
Okay. And so as Sheriff Mina comes up, if others have questions of Sheriff Mina, then we'll get everyone that has a question of Sheriff Mina to ask it when he's here. It would kind of help move this along. And then if we transition and you have additional questions, let's say if they're for Dr. Pino, and all who have questions for Dr. Pino, we want you to ask them while they're here at the podium, and that'll help with moving this along. Sheriff Mina?
Okay, Jerry Askin, News 6. Who are you seeing staying open and not complying by this stay-at-home order over the past weekend?
Right, so over the weekend, we had a number of crafts and art stores that remained open. We worked through that with their corporate offices, and they were able to comply with the order. Then yesterday, we had a number of beauty salons that were in violation of the order, some barbershops. And like I said earlier in the week, we're going to give the benefit of the doubt, go and give warnings first, and all of them did shut down after we sent deputy sheriffs there to tell them that they were in violation of the order, and but we're going to continue to follow up. And we know that many competitors are calling us because they're seeing these shops open.
Sheriff, on a scale from 1 to 10, Michelle Meredith with Channel 2, what would you give the county's effort at staying at home? Scale from 1 to 10.
So I think we're doing a good job. I would say we're at a 7 or 8, and we need to go all the way further. So we're like a C or a B, but we want to be A+. I think we could do a lot better. As I drove around the county today and I drove over here, it just seems like there's a lot more people out than should be out. So we just want people to stay home.
Sheriff, it's Sam from Fox 35. Do you have a number figure of how many warnings and have been given out and how many arrests have been made and how many businesses have been given a warning?
So we're tracking that. We get numerous calls. Off the top of my head, I would say less than 15. We have not made any arrests or issued any notice to appears. Everyone seems, once law enforcement is called there, the businesses are working with us and shutting down, and then there are some that have worked through some of their corporate offices, but eventually shut down as well.
Are the warnings written so you guys can keep track? So if there's like a second warning, then you take that next step? Like what will be the turning point when people do start getting fines and
Right, so every day we're documenting all that in our kind of a situation report that I see every day. So we're aware of the frequent offenders, and our commanders are aware if they reoffend. And but like I said, everyone has, once we have said you are in violation of the executive order, you need to shut down, they have shut down.
This is for Dr. Pino and Mayor Jerry Demings, Ryan Gillespie at the Orlando Sentinel. Are either of you aware of any clusters at this point of cases or any specific areas of the county where there appear to be more frequent cases?
Yes, there are some clusters. Now that we have sufficient data, we will start analyzing the data this week. You need to have a sustained number of cases in any epidemic to be able to run different data analysis. There are some clusters. The TSA at the airport has 8 people that have been infected. So that's a cluster. It seems like some of those individuals live together, share space. So that may explain that. So we are going to look for what is the explanation behind those clusters. There was a little, the city of Orlando is the 4th in the state. So at large, that's a high concentration of cases, more than 200 in the city. 100, and I have the number right here. Winter Garden has some high numbers as well in the total number of cases in the county. So we are going to start analyzing those cases, look for frequencies, who's getting sick is an important data, and also who is getting more at risk from poor outcomes. That will be another important data to analyze.
Okay. Other questions for Dr. Pino?
Lauren Seabrook, Channel 9. Dr. Pino, I know over the weekend you were asked about this. The governor had mentioned the anti-malaria drug coming to Orlando. What information have you learned about it? I know the FDA approved it on Sunday. What information do you have about it, how it will be used here in Orlando, and what are your thoughts on it? Do you feel like it's safe and ready to be used?
So I'm not the best person to answer that question in the sense that I'm not involved in clinical care. I think each of the systems, the 2 large systems in the city, would be better suited to answer that question. But I know the same that you know right now. There has been some benefit. I read the paper that was out of France, and it seems to be appropriate to explore what the possibility of other drugs are.
Hi, Dr. Pino, Justin Soto at Channel 13. Wanted to know if you guys have any data on the number of beds, ventilators, and staff in the hospitals right now that are being used for this crisis.
So I don't have the exact numbers, but the mayor, and I'm part of that call every day, has a call with the systems, and we have asked every single time, and they are not at full capacity. They still have beds. Our systems are not overwhelmed, and we want to keep it that way. And it's important now that you have given me opportunity to tell our people, keep yourself away from the ERs. The ERs is not the place to receive primary care. The ER is a place that you go when your life is at stake. And if you are concerned about a virus or any infection, but for that matter, the ER is not the best place to be, because that's a small space where you are going to find a high concentration, the probability of high concentration of people who may have the disease. So it's not the place to go.
Thank you. Quick question for Mayor Demings, if I can. Wanted to know if the county believes that the extended social distancing guidelines from the president yesterday will extend the stay-at-home order here in Orange County.
Again, we will make that call based on the data that we have with our experience here in Orange County. It is likely, however, that when we get to April 9th, we may have to extend that, but again, we won't make that final decision until we're able to analyze the data. Now, there are some people in our community who ask us many, many times each day, why aren't we doing more to put this community on a lockdown? I hear that. They see the numbers going up. But quite frankly, in order to, if we went to a total lockdown within our community, it requires preparation. We still have people who depend on their primary food source to come from the restaurants. We will have to, in order to do a total lockdown, that means that no one will be going to work, essentially. We are still dependent upon our food chain to operate within this community, the truckers and the others who are taking food to our grocers, to our restaurants, and other life, safety, and health-related businesses that operate, we still really need them to do that. So we're not at the point where we could be even effective at a total lockdown. So what we're doing today is a measured approach, I believe, for the most part. It is working in our community. Most individuals that I see are practicing this social isolation, social distancing, and they're doing a pretty good job of it. It's too early to tell if any of what we're doing is being impactful. I do believe that based upon conversations with physicians here within this community, the numbers that we're seeing now in terms of the increase daily within Orange County are related to the spread of the virus that occurred before we went to any of these executive orders or stay-at-home orders within Orange County. So at some point, that number is going to peak. We know that we're not at that point, and I want to stress that we do not want to peak at a point where we overwhelm our existing capacities within our hospitals. If everyone works together, we should perhaps avoid that from happening in our community. But I believe that we haven't seen the worst, and even if it gets worse in this community, we want that to be at a manageable level, and we can't do it without the assistance of everyone. And I know that Michelle Meredith had a question for Dr. Pino.
I have a question for Dr. Pino, yes.
Yes, I could tell. I read your body language. She was leaning towards you, Dr. Pino. So, Dr. Pino.
Oh, Dr. Pino, this has to do with medical supplies from the state. How much have you asked for? How much have you received? And how long did it take? Are you satisfied with the time that it took? Because I understand the distribution center is right here.
So there are two lines of distribution. Emergency management send their products to the county emergency manager. So I have no connection with that. Well, I will not know what is coming that way. They will have to tell you that. With regard to the health department, we do have our own stockpile here in Orlando, and we have sufficient to manage our activities for the foreseeable future. With regard to supplies, are we pleased? No. The main supply that we're having issues with, and is across the nation, is the testing collection kits. And that's what we need the most, so that we are able to ramp up our ability to do tests. And if we have those, we will have a driving through in 48 hours.
So but these supplies don't, the collection kits, they don't come from the state? I mean...
Yes, they come from the state health department, or I also have the ability to procure myself. But we have gotten some from the health department, yes.
Dr. Pino, before you go.
I would echo what Dr. Pino says to your question about have we got adequate supplies, what have you, through the state resource? No. It's simple as that, no. We have a number of requests in through the state emergency management system, and we're still waiting. But we're part of, I think, a demand that is throughout the entire state of Florida, and so there's, we're still optimistic that we will get all of the various supplies that we've requested. Dr. Pino?
Dr. Pino, and this might be a supply and demand issue as well, but do you have any plans of opening any new testing sites in addition to the convention center and over on Elephant Trail?
What we would like to do, if we could and have the supplies, as you said, is to open a drive-through testing where anyone who wants to be tested will get tested. But we are not there. That will require thousands and thousands of test kits. But we do have the capacity to do that. And I want the public to know that the Orange County Health Department and the county health services, we have the capacity to do that. We have the training, we have the ability, we have the equipment, we have the tools that we need. We have the sites, we have the mapping, we have planned for it. We are currently planning for it in case that we get those collection kits.
This question's for Mayor Demings. Lauren Seabrook with Channel 9 again. You touched on it a little bit, but I think some people in the public in Orange County and Central Florida, when we watch the governor's press conference, it seems as if a lot of the focus is on South Florida because there are so many cases there. With the lack of testing here and the true ability to know how many cases we have in this area, do you feel like you're having to compete with South Florida to get some of those supplies and testing? And if so, what can be done to make sure that we're getting adequate amounts here?
Well, very good question. We do have limited supplies within the state of Florida. I think the governor will tell you that. And so the priority has to be where there's the greatest demand or need for the supplies. And right now, it's in South Florida, but we have our needs here. So through our Emergency Operations Center, we're part of the state's system, if you will. And so all of the requests that when we see a deficit of something, it is entered into a mutual system here. And we are waiting on additional supplies that could be used for first responders and otherwise within our community. So I know that they're working across the country. This pandemic obviously is impacting the entire nation. And so manufacturers and others really have had to increase their production in order to meet the deficit of needs that we have as a country. So somewhere within that, as the mayor of the county, I work with the other mayors here within the county, within the region, to try to make certain that we have adequate resources to be able to respond to whatever our needs are. In terms of the needs today, we have supplies, adequate supplies to be able to meet that need. If we were looking at the numbers continuing to escalate, do we have all the supplies necessary for the next 2 weeks to 30 days? The answer would be no. And so that's where we have to work within the governor's authority as well as within the federal system to get what we really need long term. Okay. We're planning for the worst, okay, and we hope for the best. We're planning for the worst, but hoping for the best. Okay. If there are no other questions, okay. Oh, we do have one over
Mayor
here.
Demings, this one's for
Yes.
you. I've talked to several business owners who are still having to pay rent at their businesses. Are those individuals eligible for rent assistance for their businesses, not their individual homes? And if not, what can they do to help cover their rent costs when it comes to their business space?
The crisis assistance funding that we have established here within Orange County is for individuals, for families. For businesses, with the entire stimulus package, relief package that the federal government has put in place, there are some dollars available. They're calling them loans that could ultimately become a grant, meaning that they don't have to repay. But there's some criteria. A business will have to commit to continuing to employ at the same level prior to the crisis for the next 60 days, I think it is. And if so, if they're able to apply for the loan assistance program through the Small Business Administration, perhaps in terms of their budget, that budget will then free up dollars. If they get dollars coming in to keep people on payroll, perhaps that will free up dollars for them to be able to pay their rent. So we would encourage small businesses to really pay attention to all of what the federal government is putting out currently regarding business assistance.
On the pause on evictions, does that also count for?
So in terms of the here within the 9th Judicial Circuit, the Chief Judge agreed with local law enforcement to suspend the eviction process today. But that's not going to be forever. That's something that they're evaluating, and as long as we're under this state of emergency, that will likely continue. Okay.
Well, I'm going to shift to Dr. Zuver, if I could.
Dr. Zuver.
So front lines in the hospitals, the amount of supplies, do you have what you need? Do they need more? What are the conditions like in our hospitals? We're hearing about them in other places of the country.
Sure. Do we need more supplies, like the mayor said? Absolutely. Do the hospitals need more supplies to sustain this effort as it progresses along, and especially if things, our numbers get worse? We will need more supplies. We have supplies right now. We can't be frivolous with their use. I'm not at all implying rationing or anything like that, but we just have to be smart about what we do with our supplies. We're at a heightened level of caution for presentation from infectious disease, so we're taking added precautions as well, and that increases our rate. The hospitals have said they're not at capacity, but we still see a good volume of patients, and many of them we have to assume they could be exposed until we know otherwise. So there's precautions being done both in the hospital and then as well in the pre-hospital side for folks who we really don't feel confident we can get a good evaluation about their risk. So we're using supplies at a much greater rate than we typically would.
We've seen some terrible conditions in other hospitals. What are our conditions like?
We're not like that. I'll just come out and say that right now. Our hospitals are not like that, but we're preparing that could come. We have to prepare for the worst possible scenario. All the hospital systems are making plans. They're exercising regularly their plans for a surge from a pandemic response. And I think we're making sure that all the providers are adequately versed in the proper infection control procedures to make sure we can keep everyone in the hospital environment safe. As part of that, the hospitals have visitation restrictions and requirements for patients requiring masking as well. So we're working hard to make sure to do our part inside the hospital as well to decrease transmission.
All right, let me just conclude by saying thank you to all of the participants this afternoon. Thank you to the media for being here. We look forward to continuing to work with you as we disseminate information of value to the residents of Orange County. Thank you.